Start.
Hello, myself dr.soman, Professor and HOD, Department of Case Taking and Repertory, Anantarapan Pathologic Medical College and Hospital. Today, I am going to speak about a very important topic of classification of repertory. In this part, I will be mainly dealing with objectives of learning classification of repertory, general principles of classification of repertory, general review of classification of repertory.
Start.
So let us see first the objective of learning classification of repertory. Exam oriented objectives. Usually in question number 1, 2 mark questions are asked on this topic, classification of repertory. A specific type of repertory is asked and an example is given, or vice versa. A question is asked regarding that name of repertory is given and identify the type of repertory. Then in question number 2, question number 3, short notes are asked for 5 marks on the special type of repertory. Sometimes in short note specific repertory is asked, and if you don't know anything about that repertory and if you know that this repertory belongs to this type of repertory, at least you can write about that type of repertory, which will give us you minimum 1.5 mark definitely. Then question number 4, there is specific long answer questions dealing with classification of and type of repertory, which is for 10 marks. And then oral examination, examples are asked for different types of repertory, or repertory name is given and type is asked. Then the academic objectives are, once you know the classification of repertory properly, you can help, or this will help us in the selection of repertory. It will aid in the study of repertory, especially studying the philosophy, content, utility and arrangement of that repertory. So first we will see the need of classification of repertory. Now we have just seen the evolution of repertory, which has been there for near about 2 centuries, and in these 2 centuries there are more than 200 repertories which are properly established, which are properly used. And these repertories were not created just as a hobby, but this repertory has been emerged as a solution to the number of difficulties faced from time to time. So each repertory has some thought process behind it, and every repertory has also different content. For example, a regional repertory will focus on the region, a general repertory will focus on the symptoms of all body, and similarly the individual homeopaths also have different expectation from repertory. And in order to get the maximum output or utilization of a specific repertory, to get the clarity about the specific repertory, this classification is very much required. Now there are different classifications of repertory given by different authors, but there is no standard classification which is well accepted. But from this survey of this classification of repertory by different authors, we can summarize there are certain principles of this classification. The one important principle is the repertories are classified according to philosophy of repertory. Second one is the content of repertory, depending upon the what kind of arrangement is followed, what kind of facilities are provided, and what kind of format that repertory is present. So we'll also take a general review depending upon this principle of classification. Now first, classification depending upon the philosophy. Depending upon the philosophy, there are 2 broad types or 2 broad groups of repertory. One is repertories with philosophy, it is also called as a logico-utilitarian repertory. Second one, repertories without philosophy, it is called as Puritan repertory. Depending upon the content, what exactly that repertory contains, the repertories are classified into general repertory, regional repertory, clinical repertory, and depending upon the arrangement, this is a specific type of repertory, that is alphabetical repertories. Then depending upon the facilities provided, if there is some kind of mechanism is used, it is called as mechanically aided repertory. If computer is used, it is called as computer repertories. And depending upon the format, whether it is in the format of book, whether it is in the format of loose cards, types are also existing. And there are also certain special repertories which are mainly symptom oriented repertories focusing on a specific type of symptom and depending or focusing on the depending or focusing on a specific type of class of a drug like nosode, biochemical remedies, batch flower remedies, etc.